Okay, what's the difference between high volume liposuction and low volume liposuction? Traditionally, high volume liposuction is considered to be any volume of over 5 liters removed. There is no really big studies. It's kind of, I hate to say, just sucked out of the finger, the amount. But for some reason, majority of the states and agencies and even professional societies consider that 5 liters is some kind of arbitrary benchmark. So in the state of New Jersey, where I'm at, we're not allowed to remove more than 5 liters, kind of legally, on the outpatients type setting. Routinely, I remove between 5, 10, or 15 liters from majority of the patients, at least the patients that I see. So I routinely do high volume liposuction. Some people mentioned mega liposuction or whatever it is. I consider the 5,000 mark as either below 5,000 or above 5,000. So below 5,000, the requirement is you can do in a outpatient surgery center. Above 5,000, you have to usually stay overnight or do it in an outpatient hospital. At least that's a current legal requirement, okay? But there's a significant difference in the way surgeons should approach high volume liposuction versus low volume liposuction. And unfortunately, during our training, because majority of the time we train on the low volume liposuction, we really are not taught how to consider all these issues. So if you're just learning about lipedema and you think you need high volume liposuction and you're looking for a provider, first of all, I suggest going to someone who is familiar, comfortable, and experienced in doing that. If you're going to a local plastic surgeon, at least let me prepare you for what kind of issues you may need to consider, okay? First of all, whenever we do liposuction is we inject the local fluid, and the local fluid that's injected has 3 or 4 ingredients. One is a saline solution, one is a lidocaine to numb the tissues up, the third one is epinephrine to shrink the blood vessels, and a lot of times we add the fourth one, which is bicarbonate solution, and what it does, it helps to stabilize the pH of the injected solution and mitigate the pain, discomfort, and make sure the solution works a little bit faster. And there's some clinical reasons for that. I'm not going to bother you with that. But here's the issue. Whenever we do low volume liposuction, we need to numb up the patient very well so they can do it on an outpatient basis and not use too much anesthesia. So we use more lidocaine. And if we use more lidocaine and we inject 1 or 2 liters of solution, it's all fine. But when I add 6, 8, 10 liters of solution, suddenly that 50 milligrams of lidocaine per solution liter becomes overwhelming, and it can create significant issues with the patient, including cardiac toxicity, arrhythmias, and so forth. So whenever we do high volume liposuction, we have to significantly decrease the amount of lidocaine that is used. Otherwise, it'll cause toxicity. So lidocaine toxicity is number 1. Number 2, majority of the surgeons do not really even look at epinephrine. But the problem with epinephrine in high doses, which we use for high volume liposuction, is that at dose level, it can constrict the blood flow through the kidneys, through the renal arteries. So we really have to watch out for the kidney, for the urinary output to make sure the kidneys are not affected. And we have to have a proper testing of the kidneys before the surgery to make sure that you can tolerate the surgery, okay? The next step is we have to look at the amount of fluids going in and out. So there is I think 1 or 2 articles that talk about that in general. So what we do is we add all the fluid that was put in the body, including IV fluids and including the fluid that's injected by the surgeon. Then we subtract the amount of fluid that came out, which is suctioned fat, suctioned fluid, and the urine output. So that was called residual fluid. Then that residual fluid is compared with your body weight, and based on the formula, we have to determine that if you have issues with the blood pressure, what do we do? Do we put more fluid in? Do we give you diuretic? Do we give you blood or whatever? So the surgeon who is going to do high volume liposuction should be prepared to do all 3, okay? And if you're doing it in some kind of office, it may not be the safest choice. Okay, so fluid management. The next question, which is one of the most common questions that I'm asked, is how much can I remove during the high volume liposuction surgery? Everybody wants to remove as much as we can. So there's a formula that I follow. And here's the formula the way it is. For every 2.5 liters of fat that I remove with power-assisted liposuction, your hemoglobin will drop by 1 point, okay? So if the patient has hemoglobin below 7, they usually require blood transfusions. And usually people come in for lipedema surgery, they have hemoglobin between 12 and 13. So let's take somebody who came in with hemoglobin of 13. So 13 to 7 is 6 points, right? 6 points by 2.5 liters, it's 15 liters. So if you came in with hemoglobin of 13 and I took 15 liters of high volume liposuction out with not too much blood, then we expect your hemoglobin to drop down to 7. So below 7 we don't want to be, because now we have to do blood transfusions. So we try to keep you up above the level of 7. So the amount of fat that I can remove during the surgery is not only limited by the amount of fat you have, but by the level of hemoglobin that you have. There's only, again, 2 or 3 articles that talk about that. And after doing a lot of research and having a lot of experience with high volume liposuction, we also pay attention to hemoglobin. Also, we have to look at the size of your red blood cells in your blood test to make sure that your body is able and ready and is producing additional red cells prior to surgery. And sometimes we have to put the patients on iron supplements prior to surgery so that we can bring their hemoglobin up so we can remove more fat during the surgery. All right. And here's one of the other reasons why we space the surgeries at 3 months, to make sure your hemoglobin level can come up to the proper level prior to the next surgery. All right. Hopefully it makes sense.